on ramipril. His blood pressure remains 152 90mm Hoj. Which drug should be added first for secondary prevention? A. Alpha blocker. B. Beta blocker. C. Thiazide diuretic. D. Direct vasodilator. Answer: beta blocker. Page 656, CTC 2018 explanation. In post-MI patients, ACE inhibitor plus beta blocker is strongly recommended for cardiovascular protection. Q2. A 62-year-old woman with hypertension develops ankle edema after starting amlodipine. What is the best management? A. Stop amlodipine and start a beta blocker. B. Reduce amlodipine and add an ACE inhibitor. C. Switch to thiazide diuretic. D. Add spironolactone. Answer: B. Reduce amlodipine and add an ACE inhibitor. Page 659, CTC 2018 explanation. Calcium channel blocker-induced edema is reduced by adding ACE inhibitors or ARBs rather than stopping therapy outright. Q3. A 54-year-old man with resistant hypertension on ACE inhibitor, calcium channel blocker, thiazide diuretic continues to have uncontrolled blood pressure. Which add-on agent is supported by evidence? A. Clonidine, minoxidil. C. Spironolactone. D. Hydralazine. Answer: C. Spironolactone. Page 654, CTC 2018 explanation. In resistant hypertension, mineralocorticoid receptor antagonists, spironolactone, are effective add-on therapy. Q4. A 72-year-old man with hypertension and atrial fibrillation is being treated for rate control. Which antihypertensive class is preferred? A. Beta blocker. B. ACE inhibitor. C. Calcium channel blocker, amlodipine. D. Thiazide diuretic. Answer: beta blocker. Page 657, CTC 2018 explanation. Beta blockers are preferred in atrial fibrillation with hypertension because of rate control benefit. Q5. A 45-year-old woman with hypertension is found to have bilateral renal artery stenosis. Which drug class should be avoided? A. Thiazides. B. ACE inhibitors. C. Beta blockers. D. Calcium channel blockers. Answer: B. ACE inhibitors. Page 653, CTC 2018 explanation. ACE inhibitors and ARBs can worsen renal failure in bilateral renal artery stenosis. Q6. A 75-year-old frail patient with hypertension presents with orthostatic hypotension after treatment. Which antihypertensive agent is most likely responsible? A. Thiazide diuretic. B. ACE inhibitor. C. Alpha blocker. D. Beta blocker. Answer: C. Alpha blocker. Page 659, CTC 2018 explanation. Alpha blockers frequently cause postural hypotension, especially in older adults. Q7. A 60-year-old man with hypertension and chronic kidney disease, proteinuria present, is on hydrochlorothiazide but remains uncontrolled. Which change is recommended? A. Add loop diuretic instead of thiazide. B. Switch to beta blocker. C. Add ACE inhibitor or ARB. D. Use clonidine. Answer: C. Add ACE inhibitor or ARB. Page 655, CTC 2018 explanation. ACE inhibitors or ARBs are indicated in hypertension with proteinuric CKD for renal protection. Q8. A 50-year-old woman with metabolic syndrome and hypertension is considered for initial therapy. Which class is most beneficial? A. Beta blocker. B. ACE inhibitor. C. Thiazide diuretic. D. Alpha blocker. Answer: B. ACE inhibitor. Page 657, C 2018 explanation. ACE inhibitors improve insulin sensitivity and are preferred in metabolic syndrome compared to beta blockers or thiazides. Q9. A 65-year-old man with hypertension and benign prostatic hyperplasia complains of nocturia and hesitancy. Which agent would provide dual benefit? A. Beta blocker. B. ACE inhibitor. C. Doxazosine. D. Thiazide diuretic. Answer: C. Doxazosine. Page 659, CTC 2018 explanation. Alpha blockers, like doxazosine, improve urinary symptoms of BPH and lower blood pressure, though not first line for hypertension alone. Q10. A 70-year-old woman with isolated systolic hypertension, 1 in 7 or 70 millimeter Hg, requires treatment. Which agent is preferred as first line? A. Beta blocker. B. Long-acting dihydropyridine calcium channel blocker. C. Alpha blocker. D. Central alpha agonist. Answer: long-acting dihydropyridine calcium channel blocker. Page 658, CTC 2018 explanation. Long-acting calcium channel blockers, amlodipine, are effective in isolated systolic hypertension, especially in elderly patients. Hazard Reference Compendium of Therapeutic Choices, CTC 2018, Chapter 28, Hypertension, pp 651 to 670. This set 2 covers special populations: elderly, CKD, post-MI, AF, BPH, metabolic syndrome, resistant HTN, testing deeper application level knowledge. Do you want me to also create